Good morning, everyone. My name is Alexis Jordan. Today, I will discuss a critical issue in healthcare, the disparities in access between rural and urban areas, and the role that family nurse practitioners can play in addressing these challenges. So, let's dive in. Okay. Access to healthcare varies significantly between rural and urban areas, but they both have their challenges. Rural communities have a severe shortage of healthcare providers, making it difficult for residents to receive timely and comprehensive medical care. Patients often have to drive long distances for essential services, leading to treatment delays and sometimes worse health outcomes. On the other hand, urban areas face a different set of challenges. Healthcare facilities in cities are often overburdened, leading to wait times that are longer, limited appointment availability, and disparities in the quality of care received, especially for low-income populations. Family nurse practitioners, or FNPs, are uniquely positioned to help close those gaps. The research done by Napresh et al. In 2021 highlights the growing role and autonomy of FNPs, particularly in rural areas, where they provide essential care to underserved populations. In this presentation, we will examine these challenges and explore solutions that can improve healthcare access for all of these. So, rural communities face significant barriers to healthcare access. One of the biggest challenges is the limited availability of primary and specialty care providers. Many rural hospitals and clinics have closed due to financial constraints, leaving a large geographic area or areas without healthcare services. Additionally, patients in these areas must often travel long distances for medical appointments, sometimes for several hours each way. This can discourage people from seeking preventive care, resulting in higher rates of chronic illness such as diabetes, hypertension, and heart disease. Another concern is the financial burden on rural healthcare facilities. Many rely on federal funding or struggle with low reimbursement rates, which makes attracting and retaining healthcare professionals very challenging. This is where FNPs can step in. So by allowing FNPs to practice independently, we can increase the number of available providers in rural areas and improve healthcare access. So for urban areas may have more healthcare facilities, but they face overcrowding and unequal access to quality care. Many hospitals and clinics operate entirely, leading longer to wait times in emergency rooms and primary care offices. Patients may have to wait weeks or even months for non-urgent medical appointments. Another major challenge is healthcare disparity. While some individuals have access to high-quality care, others, particularly those from low-income backgrounds, face barriers due to cost, lack of insurance, and language differences. Although I'm not going to be going into mental health services are also stretched very thin. Many urban communities lack enough mental health providers despite the growing demand. This creates a backlog of patients needing psychiatric care, therapy, or substance abuse treatment. FNPs can play a critical role in reducing the strain on urban healthcare systems by offering accessible, community-based primary care services and incorporating telehealth solutions to reach more patients. So how can we address these disparities? There are three leading solutions. We can expand the scope of practice for FNPs. Many states will require physician oversight of FNPs, which limits their ability to provide care independently. So advocating for full practice authority in all states would allow FNPs to serve patients more effectively, especially in rural areas where physicians are scarce. The second thing we can do is utilize telehealth and mobile clinics. Telehealth can connect rural patients to specialists without requiring extensive travel. Mobile clinics bring healthcare directly to underserved populations, addressing urban and rural needs. Policy advocacy and work. The third thing is policy advocacy and work expansion. So if you offer incentives such as loan forgiveness programs, it may encourage more FNPs to work in rural or underserved urban areas. Supporting policies that provide grants and funding for FNP-led clinics can help improve long-term access to care. So these solutions work together to create a more equitable and effective healthcare system. In summary, Healthcare disparities between rural and urban areas continue to impact millions of Americans. Rural communities face provider shortages and long travel times, while urban communities struggle with overburdened healthcare systems and socioeconomic barriers to care. However, family nurse practitioners have the potential to bridge these gaps. So, by advocating for policy changes, expanding the use of telehealth, and increasing the number of FNPs in underserved areas, we can work toward a more accessible and equitable healthcare system. So I would love to hear your thoughts. So what policy changes would have the most significant impact on expanding FNP autonomy? And additionally, how do you see telehealth evolving to meet the needs of rural and urban populations? Thank you for your time. I look forward to hearing your discussions and your questions and your discussions. My references include Napresh et al. In 2021 study. This is actually her picture, not me, as you can see. But her study provided valuable insight into FNP autonomy and its impact on rural and urban healthcare. I really appreciate you guys taking the time to listen to my presentation, and I hope that we can have a great discussion about the questions that I've given. Thank you.